Whether you're into skincare, whether you're contemplating injections, or even considering a facelift, you need to watch this video because it's exactly what I do in my clinic, what I measure. I'm going to show you a before and after of a single session of my procedure, but I'm going to be very pointed at what we're looking for. I'm going to show you some amazing footage. I'm going to talk to you about the cost of this. It also applies for skincare because I did a video on the neck, which I'll reference as well, and show you what I'm doing for the face and measuring and how I'm dealing with the neck. It's not just the face, but it's the face and the neck. You're trying to figure out what's right for you, what is it that goes on inside a clinic, and how do we measure it? Because a lot of people say, I don't see results, I'm scared of the procedure, maybe people are trying to get my money, and will I be happy? Those are the primary things. So let's dive right now into the procedure. I'll show you what I did, then we'll go to the before and afters, and then talk price. And I do want to show you sun damage because skincare plays an all-important role in getting these results. It's all about combinations. Let's see the procedure here. Here is a video of our patient after one session. You get an idea of what the face looks like. Let's go to the injection session. So here is my plasma sculpt procedure. And all I'm going to show you are the two injections, the most important ones for the before and after that I'm going to show you so it all fits together. Some people don't like seeing the injections, some do. This is the high cheek. And this is a plasma sculpt solution, and I'm doing the high cheek, and then I'm going to do the preauricular. The cheek is very important because as you see in the pictures I'm going to show you afterwards, it's going to make a difference in the nasolabial fold, in that fold at the edge of the mouth. This is going to, picture I'm going to show you after one single session. I always do two. People are happy after one, great. But here I'm going, and the level is very important. I'm on the bone. I teach all this in my virtual training, but the idea isn't to learn off this. You can't learn from these videos. These injections are in precise locations where it's anatomically safe, and we're using safe techniques. So the idea isn't to teach the injection, but rather the concept of what the cheek does, no matter what procedure you consider, be it threads or something like plasma sculpt. But when you're injecting the cheek, that's the idea, is to get some lift, to create projection, because that bone, and if you watch my video on vitamin K2 or bone loss in the face, that zygomatic bone is very important for lifting, for creating beauty, and restoring the angle. Because I'm going to show you this in next injection area, which is the preauricular area. I almost always injected. This is the area where the facelift is done. So if you see the people are recovering, there's a lot of pictures on social media about recovery. They show that. But you don't want to blunt the zygomatic angle because that takes away from beauty. You don't want to increase volume here. So we're using the gain of the area in front of the ear, and you'll notice the solution I'm injecting. Again, it's a combination product, but less important in the before and after that I'm going to show you in a moment is what it is, but the concept, because if you're into skincare, the same thing applies. If you're trying to put gel fillers in here, you better go to the bank and take a bag of money out, because you'll not only see lines of demarcation, but it's expensive. So we put some product here, we put some in front of the ear. This is one of two sessions, and let's have a little look at a picture of the before and after. Okay, so what I want you to notice about these two pictures, the before and the after over here, is just the vectoring, because this is what we're measuring in clinic. So many people come in, I want a subtle result. I don't want anyone to know. I want to look better. I want to look rejuvenated. People are being overdone because we're overlifting. We're using way too many gel fillers. But look at this, is 3D imaging. We're able to capture the vector. Look at the arrows, they're pointing up. We measure these things. We measure that we're getting lift from our injections. It's not like we're just doing these treatments without measuring what the outcome is. And you can see this is 3 months later. Sculptra PLLA and platelet-rich fibrin, PRF, work together synergistically over months. So the PLLA molecule has been found up to 21 months, but most of it's gone by 6 to 12 months, continually stimulating collagen. And that's why we add growth factor skincare. That's where it comes into play to tell the collagen, to signal the fibroblasts, hey, ramp up your production. But look at this vectoring we can measure. Let's look at another picture and I can demonstrate something even more fascinating. So if we look at this picture, the outline, if you can read down here, it says 0.82 cc. So 0.82 of volume has been created in primarily this area, the high cheek. That's what's creating the lifting. Now, how do we know that? Look at this area down here, negative 0.2 cc's. How many people walk into your clinic and say, I'm aging, I have volume here, I have fat that seems to be growing in my lower face? If you look at people, I saw it was a movie last night, it was a documentary, and it showed the person 20 years ago was just getting married, and then 20 years later, and they kept going back and forth in the documentary, and I was watching, what's making the person look great? She's probably about 50 now, but what made her, she had fillers and cheeks and lips, but what made her not look right? And it was the lower face volume. So look how we measure here. I'll remove these markings. Negative 2 cc's in the lower face by the edge of the mouth. If you can lift up this way, vector up, volume the upper face, reduce volume in the lower face, you're going to take that all day long. That's what we did with this procedure. The concept is what I want people to get out of this, because this patient could as well easily come back and say, hey, I don't see much of a result. In this case, it changed her life. She sees it. It looks natural, but how does she know? Her friends are coming back saying, you look refreshed, you look great, what are you doing? And she has the option, I'm taking my vitamins, I'm sleeping now. Or she can say, went to Dr. Johnny and had a procedure, or whoever the person was to go to. Many people can get this result, in my opinion. It's what we're doing in the industry, it's what I'm teaching. I teach these on my AMIT injectors who are getting these monthly videos from me, but many people in the industry do this. I wanted to give that concept. Let's look at something else just so people understand. If we look at this 3D image, look at the brown spots. Look at what's underneath the skin, what we don't see. When I talk to you about skincare, AHA creams, growth factors, retinoids, hyaluronic acids, these are things I'm measuring. As you imagine, as I volumize the face with these devices and treatments, the brown spots, the solar keratosis, decreases in these measurements because we're stretching, in effect, if you want to think of it that way, the skin. But yes, absolutely, we need treatments such as alpha hydroxys, beta hydroxys, retinoids, and the next step, fractionated RF, Viora, VFR, IPLs, to get the skin better. So it's not a one and done. What does something like this cost? For 2 sessions of Plasma Sculpt in my clinic, it's over $5,000, and that's where they're starting. Then they may add Botox. They might add things that they want. Botox doesn't make you look younger, so I don't include it in my procedures. Most people don't really need it if you're taking care of your collagen. So that's reducing their cost. Every clinic's going to be different, but 2 sessions, $5,000. This was after 1 session. Injectors, people who do what I do, we're never happy. My job is not to be happy. My job is to be like, what's the next step if the patient desires it? What's the next thing? You saw the brown spots. Skin cancer is something we're all attuned to. I would like to see that look more clear. A patient doesn't see that necessarily until I show them that. People, oh, my skin's clear, I don't have any sunspots. Those sunspots are coming forward. So the skincare people use AHA creams, alpha hydroxys, beta hydroxys, retinoids like the retinaldehydes I talk about all the time. Growth factor skincare. Okay, all those things are the programs I want to get the patient on. But I know she's absolutely happy now. She's thrilled at her age to look like that. A lot of it's what she's doing, but I'm giving that helping hand. I hope that helps conceptualize what we do, what we measure in practice, and where I'm coming from. I put the video up here of this patient's neck being treated because we also have to treat the neck. We don't want the face incongruent with the neck if that suits the patient's goals. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.